Coming up, the world-famous Texas Medical Center is going green. From a colossal recycling operation to the largest academic green building in the Southwest. See how this city within a city is helping save our planet. Plus, giving back to our troops and the environment at the same time. And when life gives you lemons, make your kitchen clean. Coming up on Going Green. Hi there, and welcome to Going Green, Houston's home for ecotainment. It's like a small city with thousands of residents and millions of visitors. One of Houston's busiest hubs is working to become a whole lot greener. Houston is home to the largest medical complex in the world, the Texas Medical Center.
It is a city. It is a city unto itself. We have 47 member institutions. Close to 1,000 acres.
Different administrations providing health care, education, and groundbreaking research. As a global leader, the Texas Medical Center was created to meet the medical needs of a rapidly growing city and the world. With over 70,000 employees and 4 million patient visits a year, you could be looking at one colossal carbon footprint. But there's a movement to change all that. Dr. Winifred Hamilton, assistant professor of medicine at Baylor College of Medicine, was among the first to kickstart a successful green initiative at the medical center.
One of the things that happened a couple years ago in 2006, the medical students came to us and said, we want to get recycling going.
It began as a small group of volunteers consisting of students and staff. They called themselves the Medical Center Recycling Collaborative, or the HMCRC. It's an organization co-chaired by the Senior Director of Facility Services at Baylor, Rock Moreau.
In recycling, it all has to do with quantity and location. So you have to have enough recycling material that a vendor wants to pick it up.
Well, recycling is expensive to get started. There are a lot of things to buy, and it's very people intensive. So you need people to do the collection.
To overcome the obstacles of cost and labor, the group expanded its reach.
The medical students worked with us and with facility services, and initially we collected the recycling, the paper and the cardboard, we put it in our cars and we drove to the City of Houston collection sites.
It got so big, the HMCRC became the largest customer for paper vendor Abitibi Bowater. See this compactor for paper and cardboard waste? It collects enough recyclables for pickups twice a week.
8,000 pounds.
8,000 pounds is a lot.
2 Suburbans twice a week.
Okay, so in case you didn't get that, they're recycling the weight of 2 Suburbans twice a week. That's driving up the volume of recycled waste at the medical center by 12%. Now, it may not sound like much, but over 2 years ago, it was at 0%.
We really accelerated our Green Initiatives program. And as an example, for last year, we recycled over 3,000 tons of plastic, aluminum, cardboard, paper, scrap metal. So we've been very active over the last number of years in recycling.
John Gamble is the head of sustainable practices at MD Anderson Cancer Center and the new co-chair of the HMCRC.
We've been working very diligently to get the information and the tools available to the staff so they can make informed decisions on recycling, because recycling basically is a very personal decision.
Like so many worthwhile endeavors, the HMCRC started small, but their commitment to this recycling program has paid off in so many ways.
Partly it's the energy of all the people around me, all the people that care, and the building of that energy. And the other thing is that I really believe we are making a little difference.
Coming up, the medical center takes recycling to a new level.
You can see the insulation up above. Looks like blue jeans. You might find a zipper in there somewhere.
And later, recycling to help our troops. Recycled plastic is being used in a number of products, including clothes, decking, office supplies, and more. The Texas Medical Center is going green. It already rivals the city of Houston in its volume of recyclables, and they're just getting started. MD Anderson is one of the participating institutions in the Medical Center Recycling Program. Matt Burkheiser is the Director of Environmental Health and Safety.
Well, we've recycled 32% of our waste over the last year.
A supportive staff demonstrates sustainability and energy efficiency throughout the center.
We are the #1 cancer institute, and we want to be #1 in other areas too, as much as possible.
So where are we going now?
We're going down to one of our clinical laboratories to look at a new machine we purchased that is reducing our chemical waste.
Through a tissue processor, MD Anderson takes recycling to a whole new level. So what happens in this room?
They bring down biopsies from surgery and prepare them in these machines with some chemicals and solvents, and they're prepared. These new machines that we have reduced the waste by 70% from what we used to bring out of here. It's all automated. There's less exposure for the employees. It's a greener machine. It tells you when it's time to change the chemicals out, and they're used over 6 or 7 times before they have to be disposed of.
Okay, so just that I understand, I mean, it really, when these samples come in, there's a process that they have to go through, and so those chemicals are then kind of refined through this system, cleaned, and then be able to use again.
That's correct. The samples are prepared and then taken over here for examination.
MD Anderson is committed to its green initiative.
It really goes back to the heart of Anderson, because as a part of our core values, we've been very appreciative of management's involvement and participation in the program. We've gotten their support to build out the infrastructure within Anderson.